It's important that firefighters and EMS workers here at the Billings Fire Department are eating healthy and exercising, as first responders are significantly more likely to develop cardiovascular disease than the general population. It's scenes like this that first responders work in every day, risking their health and safety for their community.
It's a great way to give back. It feels good to do this work, and really it's ever changing.
But working in a high adrenaline environment with long late night shifts can take a toll, especially when you couple that with eating unhealthy meals on the go and breathing in smoke.
You go from zero to, almost panic at any point in time of the day.
Jason Banfield is the assistant fire chief for the EMS department in Billings. He's been in the field for over 30 years and is doing prevention work to keep his heart healthy, especially knowing his family's history.
Genetically, I'm very susceptible. I have no uncles on one side because they all died at the age of 50 to 55.
Now that he's in his 50s, Jason has started seeing cardiologist Corrine Bass-Majan to figure out preventative steps in this line of work.
There's overwhelming evidence that first responders have a higher risk of heart disease compared to the general population.
One test often used to determine risk for cardiovascular disease is a coronary artery calcium scan to determine if there's any plaque buildup in the arteries, which can lead to a heart attack.
It measures the amount of calcified plaque that's already there in your coronary arteries, the arteries that supply the heart muscle. And it better risk stratifies people according to their age and their gender.
It's a test that cardiologist nurse Mackenzie Kurtz recommends to all first responders over the age of 40.
I love the prevention patients. These patients are like gung-ho to make changes, and I think seeing them after the fact is very rewarding.
And it's one that Jason also recommends to his team.
It gives us another piece of the picture to see where we're at as responders. Their prevention matters. It should be a priority to be healthy.
For a healthy heart. In Billings, Matt Carmack, MTN News.